Dear ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Allow me to first introduce myself. I am Zaharuddin bin Haji Abdul Rahman, Inspector for the Non-Industry Sector with the Safety, Health and Environment National Authority SHENA. As the regulator for the workplace safety, health and environment, as well as the radiation matters in Brunei Darussalam, SHENA remains steadfast in its belief and commitment that it can make a difference in ensuring Brunei is a safe place to work and live, delivering against an aspiration of the nation under the Wawasan 2035 deliverable of quality of life. SHENA believes in raising HSE standards in the workplace and preventing work-related injuries and in particular fatalities. As part of our ongoing drive to reach out to our stakeholders, this month we have declared it to be a safety month. In conjunction with the World Day for Safety and Health at Work, we will this month deliver key messages as presentation to you covering a number of relevant safety-related topics. For the non-industry sector, we are seeking for compliance of the Workplace Safety and Health Order 2009 in the areas such as education institution, healthcare institution, commercial building, sports and recreation, office building, as well as government building. I will be presenting on the education institution safety. This will be applicable for schools, colleges, vocational technical institutions, and universities throughout Brunei Darussalam. Before I begin, I would like to share some of the previous accidents and incidents that have occurred within the educational institution setting locally and internationally that can become a learning lesson for every educational institution. Back in 2011, we have an accident that claimed 2 school kids in one of the primary schools in Brunei Muara district, and in 2015, there was one accident when a car hit one secondary school student after crossing the road. These accidents reminded us the importance of managing the traffic within the school compound. The next accident that we want to share was back in March 2013 that claimed 2 students' lives during a university educational trip in Tawau, Sabah. Again, this accident urges us that it is vital to conduct risk assessment prior to any educational trip, especially that involves a group of students. And just recently, in June 2020, there was an LPG gas leak explosion occurred in one of the secondary schools in Sungai Akar. Fortunately, it occurred during non-school time, but again, this is a learning lesson for all educational institutions out there that the importance of managing the safety LPG, especially in making sure the right hose and LPG regulator use, as well as the maintenance of these LPG accessories to prevent similar incidents from happening again. Just to share as well, food-related accidents that were occurred especially in primary schools. This teaches us the importance of food handlers, especially in canteen, to ensure hygiene in the preparation of food and provide a right appropriate food for the children. Managing safety, health and workplace environment in educational institutions is very important as we want to avoid any unnecessary accidents like what have been shown previously. This as well can lead to teaching delays. Having a safe working and learning environment is very important, and that comes from a good management of workplace safety and health. It is vitally important education institutions should set a role model for students, as this can become part of their practice and awareness that helps to build their knowledge and perception on safety. Furthermore, having a good workplace safety and health management will also protect the reputation of the institution and build trust for parents in ensuring the safety of their children. Next, I would like to share the association of the Section 12 Duty of Employer in the Workplace Safety and Health Order 2009 in relation to have an ideal educational setting. Educational institutions should have a safe working and learning environment, as this is a part of the duty of the school's principal or managing director of educational institution. There should also be an adequate facilities and arrangement of welfare in the institution. In addition, to have a procedures dealing with relevant emergencies. It is vitally important as well, educational institution, to ensure the staff and students have the right instruction, information, training, and supervision at all levels of their activities. Carry out risk assessment is very important as well. And last but not least, a monitoring mechanism should be in place, for example, inspection and audit. Having this mechanism in educational institution will help the institution in reducing the exposure of hazard and eventually minimize risk to students, staff, and other stakeholders. Under the Workplace Safety and Health General Provision Regulation 2014, the second schedule listed the elements of safety and health management system that can be applied in educational setting. First of all, there should be a clear statement of policy in educational institution that may indicate the top management commitment in maintaining and achieving a good standard of health, safety, and environment. These also include the allocation and responsibility of safety, which required the establishment of the Safety and Health Committee within educational institution as specified for workplace, with 50 or more % at work under the Workplace Safety and Health Committee Regulation 2014. As stated previously, in regards to safety training, this will encompass necessary training as relevant for any SHC representatives or officer appointed in the institution. Training of emergency responder personnel such as fire marshal and first aider is also important. Next is group meeting. This is very important in ensuring a good communication within safety and health. Meeting should be at least held a month in complying with the Workplace Safety and Health Committee regulation. Safety promotion is to be set as a means of communication to a wider audience in the organization. This may include a mandatory requirement to have a safety induction for all staff and students in educational institutions. An institution should also have an in-house safety rules for the staff and students and be aware of the current applicable regulation available locally with regards to workplace safety and health. Next is the management of accidents and incidents, where the institution should have in place such as procedures in the event of any accident, incident, or dangerous occurrence, and the availability of reporting form to log those events as part of the Workplace Safety and Health Incident Reporting Regulation 2014. There should also be a well-structured planning and record keeping in terms of servicing and maintenance of machines and equipment that is available in the institution, especially in the higher institution where machines are used for the students' practical activities. Occupational health program need to be part of an ongoing planned activities for the institution, and this will include awareness and talks in relation to health and safety. Next is the control of contractors. This may begin from the selection of contractors during planning stage until the time when the contractors performing their work at the institution. Furthermore, management of hazardous substance is another important element that institutions should be aware of, especially in science laboratory. This may range from the storage, handling, transportation, and waste management. The next element is in-house safety inspection, which is act as a part of monitoring in order to determine the effectiveness and implementation of HSC management and identify any fault and defect. Safe work practice as well, such as the use of proper personal protective equipment, intervention, and toolbox stock prior to any practical activities. And there are two more important elements that an institution should be aware of, which are emergency preparedness and risk assessment. In case of emergency preparedness, these are critical as a wide range of emergency may occur in the institution such as fire. Finally, risk assessment identification tool that may help the institution to come up with the control measures in order to reduce possible risks from activities performed at all levels. Traffic control in educational institutions, especially the primary and secondary school, is very important. Having a one-way system may create a smooth flow of traffic in addition to implement a reverse parking policy. Barriers between student waiting area and traffic flow may be useful in kindergarten or primary level. At the exit, implementation to have zebra crossing may be crucial, as well as ensuring the availability of traffic controller. This might be overcome with the availability of a dedicated pedestrian walkway to segregate between vehicle route and pedestrian route, and most important, a secured gate at all points of entry at the institution. There are housekeeping and environmental concerns in educational institutions based on our previous inspection and visit to primary and secondary schools in Brunei Darussalam, notably an open burning, stagnant water that may provide a breeding ground for vector-borne disease, poor housekeeping in storage areas, and poor rubbish management. In the preparation for medical emergency, ensuring the availability of sick bay is necessary An institution should maintain the room in making sure it is comfortable to use, and the location of the room need to be reviewed, especially thinking of its accessibility to the emergency pickup point. Furthermore, the requirement to have a first aid kit at the institution according to the level of activities. It is also important not to mix up medical content with the first aid kit, as we notice mostly during our inspection and visit. There should also be a tracking mechanism and ensure it is sufficient to be used for the whole community in the institution. Last but not least, ergonomic and psychosocial hazard concern in educational institution. Ergonomic hazard may be overcome with a proper control in place, such as reducing manual handling activities with provision of mechanical aids. The awareness of having a proper sitting position and prevent repetitive action that may prevent musculoskeletal disorder. Furthermore, psychosocial hazard may be previously being overlooked. It refers to an impact psychological health or mental or emotional well-being of a person as a result of work-related stress, bullying, harassment, lone working, violence in the workplace, fatigue, and alcohol and drug abuse. It is SHENA vision to ensure Brunei Darussalam is a safe place to work and live, including educational institution. At the same time, in achieving Brunei Wawasan 2035, ensuring a quality of life through an understanding of health and safety. That concludes my presentation. Thank you very much for watching.